My name is Brad Sweat, and I'm here to do a poster presentation review of the poster that Alex Ho did regarding a virtual lecture with hands-on simulation of the gastric ultrasound examination. Of course, this was addressed as a prospective quasi-experimental pre-test, post-test design. And when we go back and start to look at exactly what we're going to be analyzing on this and critiquing, I think he did a very good job as far as creating the poster presentation that is available. Using the rubric that was provided with us, you can see a statement of research, problem, and rationale. It is clearly stated, the hypotheses being addressed. There was a missing PICO question, however, that was addressed in the research problem. And so I don't know if maybe the analysis of the PICO question may be not as pronounced. In the original research study that I had pulled up. So as far as the first portion of it, I would give a 3 out of clearly stated questions. I give a 3 as the well-explained rationale and justification for the study. And as far as the project objectives, and they are clearly outlined. So that's clearly a 3, 3, and a 3 as far as I'm concerned. Regarding the literature review and background theory, he did discuss a lot of the relevant and previous work, and it was thoroughly reviewed. And in fact, you can see it clearly delineated out on the poster presentation that Alex did, and clearly gets a 3. It demonstrated a very big gap in the knowledge and why we are exploring this topic and why it's important to our field of anesthesia. I clearly give that a 3 as well. So the succinctness of it, it's clear as well because he addressed basically the key highlights of each of the different studies that the original researcher had posted and made it succinct. So these are the key elements that why they are studying what they are doing it. So I would give that a 3 as well. So we're looking at 9, 18 total so far. And then as far as the references being cited appropriately, he did clearly cite the reference. Alex did cite the reference that is in the references section. The only thing that I would have done a little differently, and I'm not sure regarding APA format, what fills in or not, but in the literature review, the research is clearly addressed. The literature is clearly addressed. And there are references that are made within that literature review that are not placed at the reference section that's there. So for that reason, I would go for more like a 1 or a 2 probably on that level. So that would put our score right at 20 so far. Moving down to the methods, there is a very clear description of the methods that are used. And what I like about this design is the pre-test, intervention, post-test. Clear description of the methods, how they able to achieve the results that they did, and the methods that they use were appropriate to address and aim towards the question that was trying to be sought after. Now, the original researcher had different plans prior to the COVID pandemic on how they were going to tackle this research project, but because of the social restrictions that were placed on it, the researcher had to pivot and readjust. And this is as close as they could as to being able to answer the questions that they originally sought under the current guidelines because of a national pandemic or international pandemic. So for that reason, I would give a 3 for clear description. So that's 23. As far as to address and aim at the question, I would maybe drop that down to more of a 2 just because of the fact that it happened in context of a global pandemic. And so that it was not as specific at addressing that question as what the original researcher had wanted to do. Now, as far as Alex's poster presentation, he did awesomely. There was no issue as saying this is what they wish to aim and address that question at. Because of the simplicity of a pre-test, post-test design, the conclusion and discussion, it's pretty much that they were able to come up with a context of information that they could apply towards what they got as their conclusions. So I would easily place this so that they got the results that they needed to do. It can easily be applied toward any part of the anesthetic perioperative performance that's there. And the importance of the findings are highly significant because of the rate of cost and readmission, death, mortality that's associated with aspiration with full stomach gastric contents. So I fully give that an additional 12 points, bringing it to 34 points altogether for the conclusion discussion. The succinctness and appropriately and clear data that's presented in the tables that are on there were accurate and clearly logical to follow. So that gives an additional 3 more points, bringing us up to 3, 9. So we're looking at 41% on the rubric. And the overall presentation, it was not flashy as far as Alex's poster presentation went, but it was very succinct, it was very professional, and it followed a very logical flow. And I feel like he did a wonderful job being able to summarize the key talking points that were appropriate for that also. So altogether, I mean, we're looking at, let's see, the overall aesthetic, 1, 2, 3, 4, 5, and 6. 6 points times 3, 18. We're looking at 60. I would easily give this a good solid A, mid A, to a low A plus as well, as far as the way that Alex did everything. Now, there are 3 things that I would do a little differently. 1, I would like to see what this does where you actually use an intervention where there was a in-person use of the ultrasound probe rather than using a bar of soap or a cell phone to indicate the position of the probe, so that you actually visualize and handle the probe, because there is a very big discretion between learning something didactically online through a Zoom call as opposed to in-hand interpersonal observation that's there, and they can kind of guide you on what the proper placement things are. And I feel like there would be a greater sense of learning retention from actual application of that. Since they had to do everything through Zoom call, basically it was not that accurate as far as getting the same feel that you would with an actual ultrasound machine that's there. Furthermore, I would also like to see what this would be in context of now with all these the injections for weight loss drugs such as Ozempic. We're having to develop new current NPO guidelines, and also when they can have surgery based on when they've had these particular shots. So I would be curious to know what the gastric contents versus an Ozempic patient would be versus somebody that is just clearly status quo. The third and last thing I would like to address on that would be, I noticed that an overwhelming 70% of the participants were student nurse anesthetists, and then the other 30% were practicing registered nurse anesthetists. What I would find most interesting is at the end of the original author's research, there's an overwhelming response saying that they would apply it to their own practice. However, it's just not feasible to do in the real world setting, just because a lot of smaller hospitals and mid-sized hospitals don't have a lot of access to this type of equipment on a continuous basis for the amount of patients that we see. So what would be most interesting for me to research more into is how willing are actual CRNAs willing to incorporate this into their practice, as opposed to student nurse anesthetists who may not have had the full extent of real-world knowledge into the feasibility of, is it even feasible to work into your practice at a steady rate enough to be able to say it is a gold standard or not. I think the experience that comes with this would be really, really beneficial also to have it with people that have been practicing for 5 to 10 years, 10 years plus, and kind of compare it to see what their responses are for them wanting to incorporate it into their practice. So, and basically those are the surveys that I had that's there. Now, as far as like in summary, what I have learned pretty much from this semester has been quality incentives are not just a measure of getting a merit-based incentive, bonus pay, or anything like that, but it's that continuous need for us to want to provide the best practices that are out there. So as we are gaining knowledge and reporting off on it, it gives us some sense of, indication as to how well we are doing as anesthesia providers. The biggest thing that I have as far as a problem, and this will be my second talking point that I've learned, is that everything is self-reporting, and that is so frustrating because you're not necessarily getting the accurate results. I know that currently in my own facility, a lot of people do a lot of pre-charting of the results, and you can't necessarily do a QI project when you have people that are pre-charting things that may or may not happen. And then something may happen and there's already been submitted as far as what their merit-based QI is, and there's no changing it, so it's already been self-reported as such. And so how accurate are the results really for the most part? And then the final thing that I've learned this semester is that just because what works at one facility may not work necessarily at another facility. And that's going to be based on like the localities. And I always personally knew that was the case. However, a lot of people basically think that once there's one standard guideline or one standard practice, it is cookie cutter and fits across all elements. And things are different based on region, localities, resources, things like that, that sometimes evidence-based practice at one facility will not necessarily correspond to the same results that you would get at another facility as well. And for that, I'd like to say thank you for a really great semester, and I look forward to working with you again.